Good morning. Dr. McHenry coming to you on Tuesday, May 12th, the second day of our state reopening. With that being said, there will be more cases being reported. So I want to talk about what a case means. A case means a positive COVID result. Now that does not mean the person is sick. Doesn't mean that they're not sick. It just means it's a case of a positive test. So with more widespread testing and more people out in the community, we will see more cases. Again, that does not mean sick people. It does not mean that they're not sick. It's just a positive case. So don't let the numbers worry you excessively. To date in our state, we have tested 150,241 people. We have 11,380 positive tests out of that 150,000. That's a positivity rate of about 7.5%. That number will probably go up closer to 10%, but again, the majority of the people testing that are positives are asymptomatic carriers. That means they have no symptoms, they just carry the virus, their body's made an immune response, and they're doing fine. Of that 11,380, cumulatively, 1,500 of those people were hospitalized. That just means they were put in the hospital overnight, more than 24 hours. They could have been in and out in one day. They might have been in the intensive care unit. They possibly could have been on a ventilator. We don't have cumulative data on patients in the intensive care unit or on ventilators. On a cumulative number, we only have current numbers for those. So that being said, don't let the numbers going up concern you excessively because we have to look at what a positive case is. I also encourage you to continue to practice safe distancing and wearing your mask to make others feel more comfortable. The masks that most people wear give a very mild protection to you yourself, but what it's doing is protecting others from your respiratory droplets. Many people can be asymptomatic carriers and hence wearing the mask to protect others from your respiratory droplets. Again, when you're in stores, when you're in close confines, please go ahead and wear your mask to make others feel better. If you're outdoors and you have plenty of room, I encourage you not to wear the masks. If you're a high-risk patient above 60, you have chronic illness, you have diabetes, you have high blood pressure, you have a history of cancer, immune suppression, etc., I encourage you to wear a mask at all times to, again, protect yourself a little more from potential inhalation of respiratory droplets. So with that being said, offices completely open. We're seeing patients for everything. So if you need physicals scheduled, if they were delayed due to the initial stay-at-home orders, please contact the office to schedule those. We are booking into the summer already for physicals. And with that being said, I wish you well and have a wonderful week. Thank you.